You fill your dog's water bowl in the morning. By afternoon, it's empty. Again. At first, you think maybe they're just thirsty. Maybe it's hot outside. Maybe they played more than usual. But then you notice they're drinking constantly. Longer gulps, more frequent trips. Now you're wondering, is this normal? Or is something wrong? Dogs naturally adjust their water intake based on activity level, diet, and temperature. A dog that exercises more or spends time outdoors in warm weather will drink more. Dogs eating dry kibble also tend to drink more water than dogs on wet or fresh food diets. But when water consumption increases suddenly and significantly, without an obvious reason, it's something you should pay attention to. Veterinarians often measure normal water intake at roughly 1 ounce of water per pound of body weight per day. So, a 20-pound dog may drink about 20 ounces daily. This can vary slightly, but dramatic increases beyond that range may signal a problem. The key isn't exact measurement, it's noticing a change in pattern. Let's start with harmless causes. Increased activity naturally increases thirst. Stress can also increase drinking. If your dog recently experienced a change in environment, visitors in the house, loud noises, travel, or a shift in routine, mild stress could temporarily raise water intake. Certain medications, especially steroids like prednisone, are also known to increase thirst and urination. In those cases, the cause is predictable. However, excessive thirst, medically called polydipsia, is often linked to underlying health conditions. One of the most common is diabetes. In diabetic dogs, blood sugar levels rise because the body cannot properly use glucose. The kidneys try to remove excess sugar through urine, which pulls water along with it. This causes increased urination, which leads to increased thirst. Dogs with diabetes may also show increased appetite, weight loss, and lethargy. Kidney disease is another major cause. The kidneys regulate fluid balance and filter waste from the bloodstream. When kidney function declines, the body loses the ability to concentrate urine properly. Dogs urinate more frequently and become dehydrated faster, leading them to drink more water. Early kidney disease can be subtle, with increased thirst as one of the first signs. Cushing's disease, also known as hyperadrenocorticism, is another condition that causes excessive thirst. It occurs when the body produces too much cortisol. Dogs with Cushing's often drink more, urinate more, develop a pot-bellied appearance, experience hair thinning, and show changes in energy levels. This condition is more common in middle-aged and senior dogs. Urinary tract infections can also increase thirst. If your dog is drinking more and also urinating frequently, straining, or having accidents in the house, infection may be the cause. Can occur in both male and female dogs, though females are more prone. They are typically treatable with antibiotics once diagnosed. Liver disease can also affect thirst levels. The liver plays a central role in metabolism and detoxification. When liver function is compromised, dogs may experience increased thirst, appetite changes, vomiting, diarrhea, or behavioral shifts. Blood testing is essential for diagnosis. There are also rarer hormonal conditions that affect thirst regulation, such as diabetes insipidus, which disrupts the body's ability to conserve water properly. Although uncommon, it leads to extreme thirst and large volumes of dilute urine. So, how do you know when to worry? If increased drinking is paired with increased urination, weight loss, appetite changes, vomiting, diarrhea, lethargy, accidents in the house, or behavioral changes, veterinary evaluation is necessary. If your dog wakes frequently at night to urinate or cannot hold urine as they normally would, that's another sign the change is significant. Timing also matters. A temporary increase in thirst after heavy exercise or a hot day is normal, but consistent unexplained increases over several days or weeks are not something to ignore. There are also situations where water intake appears excessive, but is actually behavioral. Some dogs develop habits around drinking, especially if they are bored or anxious. Compulsive water drinking can happen, though it's less common. If medical causes are ruled out, behavior modification strategies and increased mental stimulation may help. It's important not to restrict water without veterinary guidance. If your dog is drinking excessively due to a medical issue, limiting access to water can worsen dehydration and delay proper treatment. Instead, monitor intake, observe patterns, and consult your vet for blood and urine testing if needed. The earlier underlying conditions like diabetes or kidney disease are detected, the more manageable they are. Many of these conditions can be controlled effectively with medication, diet adjustments, and routine monitoring. The danger lies in ignoring the early signs. Your dog's body is constantly communicating through behavior. Drinking more water isn't random. It's either responding to a normal need or signaling that something internally has changed. The difference is context, frequency, and accompanying symptoms. If your dog seems otherwise energetic, eating normally, and only temporarily drinking more during heat or exercise, it may simply be environmental. But if thirst feels excessive, persistent, or unusual for your dog, trust that instinct. You know their normal patterns better than anyone. Water intake is one of the simplest daily behaviors to observe, and one of the most powerful indicators of health. Don't panic, but don't ignore it either. If you found this helpful, subscribe to Paws and Whiskers for practical, evidence-based pet behavior and health insights every week.